Hi, it's Gustav here. Today, I want to talk about something that I really didn't address much in my main video, a mind-body approach to protracted withdrawal syndrome. And that's how you might apply this approach to tapering. So, when I first discovered the mind-body syndrome, I was actually still tapering a psychiatric drug myself. The last one I was trying to get off, and it wasn't going particularly well. I was having a difficult time with it, and I routinely experienced, quite scary sensations, both physical and emotional. Now, at the time, I interpreted these sensations as withdrawal, presumably from tapering and perhaps from other psychiatric drugs I'd previously stopped taking as well. I'd taken many drugs previously, some of which I stopped much too quickly. But then I learned about the mind-body syndrome and applied its concepts first to pain because I also had chronic pain, and then to these withdrawal-like sensations. And that's when these sensations actually started fading and eventually stopped virtually altogether. Now, I'll emphasize here that withdrawal sensations stopped for me while I was still tapering. So I just carried on my way and continued to taper and rarely felt withdrawal-like sensations again. And when I did, they were very mild and brought on by psychological stress or maybe an environmental trigger. And when I did feel these sensations again, I'd just remind myself about the mind-body concepts I'd learned, and they would eventually disappear without any concern. Although these sensations usually communicated to me a message about something I needed to address in my life, something bothering me. So, in a sense, I'm grateful for these relatively mild sensations that I could still feel. Now, based on what happened here, I had to come to the conclusion that tapering this final psychiatric drug was not the cause of the sensations I interpreted as withdrawal. Nor was it coming from drugs I stopped taking months or years ago, because this wasn't withdrawal at all. A mind-body phenomenon was going on instead. And now, being able to step back a bit, I can see that this actually makes sense. Because, for one, I was tapering such small amounts of this drug. I mean, why would such small microcuts cause such big problems like the ones I was previously experiencing? I just wonder how that would make any physiological sense. Now, I should mention here, of course, that psychiatric drugs can cause physical dependency and others addiction. So it's possible, even likely, that more significant cuts to these drugs could potentially cause acute withdrawal, an acute withdrawal reaction. When I first started tapering this one drug, for instance, I was cutting too much at a time and got this terrible roaming itch. This itch, drove me crazy. Then I looked it up and saw that itching was a common withdrawal sensation from that drug. So I stopped cutting and the itching eventually went away. So it is important to consider how much we're tapering and to factor that into whether it's withdrawal or the mind-body syndrome. I'd also add that being on the drugs alone can cause problems in and of themselves. So we also have to try to rule out drug effects as well, because that's also going to affect how we feel, right? I had one drug that made me feel extremely sleepy. And this feeling of sleepiness virtually went away as soon as I got off the drug. So that's also something that needs consideration. Although it is possible to experience both adverse drug effects and TMS at the same time, which is why a mind-body approach may be useful in any situation and worth trying out. But coming back to tapering and my own experience, when I was making these micro cuts to psychiatric drugs, a couple percent of the current dose or less, and this was seemingly causing me just so many problems, I think this was basically due to my fear. I mean, I was terrified of these drugs, and my fear had been building for years. Many of us don't feel safe tapering these drugs. And I was always monitoring how I was feeling, keeping, a symptom journal. Basically, all I did was teach my brain that these withdrawal sensations were the most important thing in the world and that I should be scared of these drugs. And my brain simply accommodated that belief. So even when I made the slightest cuts, my brain would send me a danger signal in the form of a withdrawal sensation to remind me to be scared of the drugs. Sometimes that would happen right away, or after a series of cuts, or seemingly at random. But it always happened. And what this created was a feedback loop, a fear withdrawal cycle between my fearful self and my brain reflecting my fear back at me and keeping my attention on this idea of withdrawal. And it's our fearful attention that, in part, allows us to learn these sensations. The other part, of course, and why we get hooked on withdrawal in the first place, is that our fear of withdrawal is associated with powerful, deep, repressed emotions. That's often the main basis of the mind-body syndrome, as I go over in other videos. In the first video I made, though, the long one, I asked, does it make sense to us that we're still in withdrawal many months or years off a drug? To adapt this to tapering, I'd ask, does it make sense to feel so badly despite making such small cuts? Assuming, like me, you're making very small cuts. Or, if still taking psychiatric drugs, does it make sense that an adverse drug effect is causing the main problem now? If we have any doubts about these things, as I came to have, and there's a curiosity to explore the mind-body syndrome, then the way to approach this is more or less the same, whether you're tapering or not. And it really starts with learning more knowledge about the mind-body syndrome or psychophysiologic disorder or stress illness, and seeing how it resonates with your life. In my experience, it's very possible to resolve withdrawal-like sensations while tapering, and then have a much better taper after that. When I finished and got off the drug, I was also just fine. In fact, it'd probably be useful to us to have more information about the mind-body connection before we start tapering. That would have been so useful to me to kind of help us prepare for how we can respond to withdrawal sensations and possibly limit the risk of them getting out of hand. Although it's never too late to apply a mind-body approach, especially if you feel that's right for you. That's it for today. See you next time.